Very often I have been asked this question, what is medical oncology and what's the role of medical oncologist in cancer management? So medical oncology is the branch of oncology where the doctor treats the patients with certain medications. As you know, the cancer treatment involves medical or surgical or radiation. Surgery means of course removal of the tumor. Radiation means giving like a high energy beam of X-rays. But what about medicines? So there are certain medications which are in the form of chemotherapies. So when we give chemotherapy, it is basically means some strong toxic substances which has ability to kill the cancer cells. It also can hurt sometimes normal cells and that may lead to the adverse effects. Another area is targeted therapy, means some kind of medications which will identify certain proteins or substances on the cell surface or nearby, and there it leads to its activation, and that's how the patient gets response. Some of the targeted therapies, especially in the field of breast and lung cancer, have shown to have massive responses and very good long-term outcome. Third, immunotherapies. This is also a medical oncologist normally does, especially when you talk about certain diseases like lung cancer, breast cancer, colon cancer, etc. Immunotherapies improve the immune system's responses towards the cancer cells, and thereby we get responses to our cancer patients. Fourth, hormonal therapies, either in the form of injections or in the form of tablets, used often for breast cancer and prostate cancer. Not only that, a medical oncologist also sees the patient in terms of getting the diagnosis right, also collaborates with his colleagues like surgeons and radiation oncologists. As you might understand, oncology means a lot of teamwork. Various branches come together in order to give the best outcome for the patient. So a typical way of looking at the patient in the form of right diagnosis, discussion in terms of the treatment, understanding and discussing the side effects, sequencing the therapies. So these are all the things a medical oncologist in general does. So whenever you have any doubts, speak to your doctor. Whenever anyone in your family is suffering from a cancer, see an oncologist, whether it's medical, surgical or radiation. And through this joint collaboration of team as team for oncology, one can get the best possible treatment and thereby get the best possible outcomes. Thank you.